Hi, my name is Dr. Steve Z. I'm one of the emergency department physicians at Enloe Medical Center, coming here to talk to you about another weekly update, this time from the beautiful indoors instead of the beautiful outdoors. Hope you've all been well over the last week. We've instituted a new service at Enloe. It's the virtual emergency department. It's a telemedicine option for you to be able to call in and ask questions and get medical care. The number to call in is 530-332-9540. The hours will be from 9 in the morning till 9 in the evening, 7 days a week. One of our nurses will field your call, they'll talk to you, they'll listen to what it is that you have to say, and probably ask some additional questions as well. At that point in time, the nurse will have the opportunity to confer with one of the doctors to see whether or not the nurse can provide you with appropriate instructions, or whether you might want to have a telemedicine visit with one of our physicians. That could be a Zoom interactive video conference, or it could be a simple telephone call if that's what you really prefer. Either way, what we'll try to do is direct your care as appropriately as possible. Now, the kinds of things you might want to call in with are concerns about COVID-19, but also minor ailments and possible accidents, things like a earache or a sore throat, or a fall where you don't think you've had a significant injury, some types of cold or flu symptoms, or whether you think something might need stitches or not. Those are the kind of things we can definitely help out with. Now, here's the really important thing. What physicians and medical communities all around the country are noticing is that people really are kind of staying at home, which we applaud, but sometimes staying at home with problems, things like severe chest pain, or shortness of breath, or severe abdominal pain, that really need to be seen in an emergency department, just like they always did. So we want to work with you to not confuse those two things that are appropriate to stay home with and things that are putting your health in jeopardy and that we want to help out with. Now, if you should call outside of those hours of 9 a.m. to 9 p.m. 7 days a week, you can leave a message and one of the nurses will get back to you the following day. But please, again, remember that if you have something that seems more serious, it very well could be, and call 911. When people come to the emergency department, we're taking all the precautions we can to separate out all the other medical problems from problems related to coronavirus 19. We have separate triage areas, and we have different parts of the emergency department where staff are dedicated to taking care of patients who are more suspicious for the virus, and staff that's dedicated to taking care of all the other problems that have always brought people to the hospital. So we want to work with you, we want to take care of you, we want to meet you where you are, whether it's in your home or the need to come to the hospital. So remember, we're here for you in any way that you need. 7 days a week, 9 a.m. to 9 p.m., you can call the telemedicine service and we'll direct your care from there. If you're calling outside of those hours, you can leave a message and a nurse will get back to you the following day. But most importantly, if at any time of the day you think you have a medical emergency, call 911 and they will take good care of you. It's a really fluid situation and things are changing all the time and we're going to continue to change with it. Our goal is always the same, however. That's to make sure that our community has the best health possible, that the people providing that health care are doing so in as safe an environment as possible so that we all can beat this thing together. Take care of yourself. Stay at home if it seems appropriate, but reach out if you need. We're here in any one of very different ways. Be safe. Be well. Thanks.